Well, the news surprised some parents today as the Ohio Department of Health is saying schools will no longer track down contacts for every coronavirus case in the classroom. Our Sarah Shookman explains the state's new focus and has perspective from public health and educators.
What we're advising parents is the exposure is everywhere.
As the coronavirus evolves, so does the strategy. Now, Ohio is shifting away from a universal contact tracing system for schools that Dr. Bruce Vanderhoff says became impractical as Omicron cases skyrocketed.
And the reality was that there was virtually no school that was able to universally contact trace students all across their district.
ODH sent a memo to superintendents in K-12 districts Wednesday outlining a new policy that requires contact tracing only for clusters or localized outbreaks. This will free up health departments to focus on high-risk congregate settings like nursing homes, while the state's safety guidance around getting kids vaccinated, keeping masks mandatory in schools, and testing for extracurriculars stays the same.
And so it was very difficult to tell where anybody was actually infected because, you could have been at the school, you could have been at the grocery store.
Commissioner Donna Skota with Summit County Public Health says the why is clear, but they're following up with the state to better understand the details.
Some assistance in maybe defining that cluster. What does it look like, and the timeline around a cluster. And we're also looking for the very thing that parents are asking, what will notification of parents look like?
Contact tracing has been a time-consuming burden for administrators, not to mention the impacts on learning.
You have to pick up where you left off. Every time you have to quarantine students, you have to bring them back and you have to play catch-up, and that's very hard to do.
Parma Community High School Assistant Principal Eric Butler says now the focus can be on keeping students in the classroom for their social and emotional health as well as educational goals.
It shows that we're starting to loosen the grip on things a little bit, and I think that's really, really important in maintaining the success of students.
Districts can report cases to county health departments weekly instead of daily starting next Friday. And Laura, Dr. Vanderhoff says things are all pointing in the right direction here in Ohio. But to be clear, this is not over yet.
But I like that. Things are going in the right direction, right? It gives
Very
us a little bit of
encouraging.
hope. It is. Sarah, thank you so much. And we have some good news.